Okay, now summarize. Do not look at this whiteboard as a whole. See where my finger is pointing and understand one by one. First, talking about parathyroid hormone, it acted on the PCT cells of kidney, helped in forming active vitamin D3, and active vitamin D3 did what? Three actions. First action is increasing calcium absorption from duodenum. Second action is it increased calcium and phosphate reabsorption from kidney. And third action of vitamin D3 is it activates the osteoblast cells of the bone, that is bone forming cells. So vitamin D3 help in bone formation. So the first action of PTH is activation of vitamin D3. The second action of parathyroid hormone is on the renal tubules. It increases calcium reabsorption at DCT, so calcium concentration is increased in blood, and since it is a phosphatonin, so it will cause decrease in the resorption of phosphate from the kidney, so phosphate will get lost in the urine, and so phosphate concentration in blood will decrease. Now coming to the third action of parathyroid hormone, it is the activation of osteoblast, which in turn activate osteoclast, and whenever the osteoblasts are activated, there is increase in the level of a serum enzyme called alkaline phosphatase. Now coming back, osteoblast activate osteoclast, osteoclast cause bone resorption, which in turn increases calcium and phosphate concentration. So now if we have to summarize, what are the ultimate calcium and phosphate concentration which is affected by PTH, then we can say parathyroid hormone is increasing calcium and phosphate, increasing calcium, increasing phosphate, decreasing phosphate, increasing calcium. So one thing is clear that parathyroid hormone is going to increase calcium concentration in the body. But coming to the phosphate, since PCT is responsible for 70% of the phosphate reabsorption, so if something that is directly inhibiting the phosphate resorption at PCT, so phosphate will get lost in urine. So even though there is increase in the phosphate from the other mechanisms by the PTH, but since 70% of its resorption is getting inhibited, so phosphate concentration will decrease in the blood. Okay, now coming to the role of vitamin D. Vitamin D, it increases calcium, increase calcium phosphate. So simply we can say that vitamin D increases serum concentration of calcium and phosphate. Now coming to the calcitonin. Calcitonin, you can simply remember, is the opposite of vitamin D. Apart from the one action, it is opposite of vitamin D. Now what is it? Calcitonin, unlike vitamin D, which was increasing calcium absorption from GIT, calcitonin is inhibiting calcium absorption from GIT. Unlike vitamin D3, which was increasing calcium and phosphate reabsorption from kidney, calcitonin is decreasing calcium and phosphate reabsorption. So more calcium and phosphate are lost in the urine, less calcium is absorbed. Third, calcitonin inhibits osteoclast, means calcitonin inhibits bone resorption, so it will help in bone forming. So this action of calcitonin is similar to vitamin D. Apart from this action, these two actions are totally opposite of vitamin D. So calcitonin has three actions we have discussed. Now coming to the FGF-23, fibroblast growth factor 23. First of all, it is seen to be increased in CKD and osteomalacia. And coming to its actions, it inhibits the 1-alpha hydroxylase. So this whole cascade of vitamin D working will not happen. Second, it activates parathyroid hormone. So these actions will happen. Third, FGF-23 directly, just like parathyroid hormone, it decreases the reabsorption of phosphate at PCT. So FGF-23 is also phosphatonin. It decreases the blood phosphate concentration by decreasing its resorption at PCT. Now coming, what are the ultimate changes in the blood level concentration of calcium and phosphate with the help of FGF-23? We see FGF-23 is inhibiting D3. So opposite of D3 action, decrease in calcium and decrease in phosphate. Again, it is acting like PTH. So increase in calcium, decrease in phosphate. And another action is direct decrease in phosphate concentration. So we can say that FGF-23 is just acting like parathyroid hormone. Parathyroid hormone is increasing calcium concentration. Parathyroid hormone is decreasing phosphate concentration. But the clincher here is that FGF-23, since it is inhibiting the D3, so calcium absorption from the gut cannot take place, and since calcium cannot be absorbed, so calcium in the blood will decrease. Okay, so what are the two final outcomes of FGF-23? It decreases calcium concentration in the blood, and it as well as decreases phosphate concentration in the blood. So we have discussed the four actions of all the four molecules and their actions on blood concentration. So now let's write it down quickly. So the agent, the trigger, and result in blood concentration. The first, parathyroid hormone. The main trigger of parathyroid hormone is decreased in calcium concentration. So what will be the result? It will increase calcium concentration, and since it's a phosphatonin, so it will decrease phosphate in the blood. Second, vitamin D. Vitamin D, what are the stimulus for vitamin D? We have seen that vitamin D is activated by direct action of parathyroid hormone. So parathyroid hormone stimulates vitamin D production. Since vitamin D is increasing calcium and phosphate, so low level of calcium and low level of phosphate can be individual triggers for vitamin D production. So vitamin D will result in increase in calcium concentration, increase in phosphate concentration. Clear till here? Now coming to the calcitonin. Calcitonin, as I already taught you, is just opposite of vitamin D3. Vitamin D3 is doing increasing concentration, so calcitonin will decrease both of their concentration. And what is the trigger of calcitonin? The trigger of calcitonin is increase in calcium concentration. Okay, whenever there is excess calcium in the body, calcitonin is increased. Now FGF-23. FGF-23 is a phosphatonin. The main trigger is whenever there is increased phosphate concentration in the body, FGF-23 is produced. And what does FGF-23 do? It inhibits vitamin D, so it will inhibit calcium absorption from the gut, so calcium is decreased, as well as it promotes inhibits the resorption of phosphate from the kidney, so phosphate concentration will also decrease. So this is the summary of these four agents. Now you can read about it more. Let me show you the reference so you can pause and have a look about this. FGF-23 and osteocytes is given in Harrison. Okay, so if you found this video useful, please like, share and subscribe to my channel, and also you can comment what topic do you want next so that I can elaborate it. And if you want to connect with me, my Instagram is ADITYAGRRG